My name is Dr. Iddrisu Abdul-Rashid Timtoni. I am from Tamale, a city in the northern part of Ghana. I work as a senior medical officer at the Gushagu District Hospital before I got the chance to specialize in oncology, sponsored by Merck Foundation. In terms of cancer care in the country, I think the problem is huge because we have few doctors who are specialized in cancer care, and I know of 2 cancer centers that serve the whole country, and we have a population about 30 million, which in my opinion is woefully inadequate. Again, we have no satellite cancer centers, especially in the northern parts of the country. So patients who are diagnosed of cancer, especially in the rural areas, have to travel miles from the north to the south in order to access these centers, which can take them hours to travel. The first point of call, I have the opportunity of working in all the level of healthcare system in the country. I work at the Tamale Teaching Hospital. From there, I went to the regional level where I work at the Upper West Regional Hospital. Then I ended up in the district hospital, that is Gushagu District Hospital, where I work as a general practitioner, that's a medical officer, before given this opportunity. So during this period of my experience, the cancer patients are usually attended to by we, the general practitioners, and the level of knowledge with regards to care that is given to this patient is not the best. So these general practitioners have to refer all these patients to the 2 centers which I said are concentrated in the southern part of the country. So this opportunity, at least after I have done with my studies, I will come back in order to bridge this gap so that I can liaise and collaborate with my colleagues and stakeholders so that we can establish a comprehensive cancer center in the northern part of the country in order to curb this problem. In terms of awareness of oncology or cancers, there is some level of awareness in the country, especially breast and cervical cancers. But we need to do more with regards to the other solid and hematological malignancies. I say this because most of our patients still come to us in advanced stages of the disease. With regards to the journey a cancer patient has to undergo in order to achieve the maximum level of care is laborious in the country. The first point of call are usually the general practitioners, and if it happens to be in the rural areas, it is the nurses at the CHIP compounds who usually see some of these cases. And if it happens that they are referred to the tertiary institutions, there are some of the institutions without trained oncologists, so these patients are attended to with the best of the knowledge of these general practitioners. Again, if a case of cancer is suspected in the country, there's a huge challenge with regards to diagnosis or confirmation of the diagnosis of the disease. As you know, cancer is not diagnosed just by one single test. You have to do a series of tests which includes imaging, so that you know where the location of the tumor. Then you may take a biopsy and send for pathology. Then after pathology, sometimes you have to go in and do molecular or cytogenetics in order to know the subtype of the tumor you are dealing with, and sometimes it helps to risk stratification of the patient. This will enable you to tailor the required treatment for these particular patients. However, we have a challenge with regards to these areas in terms of diagnosis. Most of the facilities do not have CT scans or MRI or PET scan, and the molecular and cytogenetics aspect is still a new thing in the country, and for that matter, diagnosis of these cancers is a challenge to us in the country. So after diagnosis, as I said, because we have few oncologists in the country, most of them are attended to physicians who are not specialized in this area, and the outcome of these patients is not usually the best because they are also limited in terms of knowledge and skills in taking care of these particular patients. The scholarship has helped me to undergo this training, which has equipped me with the requisite knowledge and skills, which I know I can apply adequately in order to help my patient when I get back home. Improving access to quality cancer care, in my opinion, has to do with early diagnosis and treatment. And early diagnosis and treatment cannot come if we don't create enough awareness so that the patients can report to us at the early stages of the disease, which can most of the time can be curable. So I think when I go back, apart from treating the patient, the other role I will take up is to create awareness so that we diagnose these diseases very early, and then we can provide adequate care which can lead to cure of some of these diseases. The other aspect in terms of improving access to quality care has to do with training. As I mentioned earlier on, we need more people in this field. In the country, most doctors do not like to go into this specialty because they consider it as a depressing field. And I'm sorry to say, per my experience that I have gone through in this training institution, it is not so. We can do a lot if the right tools and equipments are available. We can adequately attend to these patients and they will live their normal life. So I intend to make this field attractive to the young and coming doctors to take up this field so that we will increase our numbers in order to provide access in terms of cancer care in the country. So again, we need to train more doctors and we need to create awareness. The training should not only focus on only doctors, because taking care of a cancer patient involves a whole lot. So we have to train the nurses as well and other staff that are required in the care of the patient. I would like to thank Merck Foundation for giving me this opportunity to specialize in this rare specialty. And I know when I go back to my country, I'll be able to help my patients adequately. And also, my other thanks goes to my employer, Gynae Health Service, for releasing me for this particular program. And I also want to thank my family for the support they gave me during this period. Other programs, in terms of other programs that train doctors or that provide scholarship for doctors to train in oncology, I am not aware of one, but if there are, I think they should continue. It's a good cause, and it will help to boost the number of oncologists in the African continent. In terms of improvement of this program, I think Merck Foundation should increase the number of doctors in the African continent, so that the number of oncologists in each country will be boosted. This will help in a long way in providing access to cancer care for our patients.